Selah Hospice Care focuses on relieving pain and other symptoms in order to keep patients comfortable and improve their quality of life. Today, we'll be speaking to their staff all about when the right time is to consider hospice care. Today, we spoke to the Director of Nursing, Melissa Mata, all about how hospice works to keep patients comfortable during their end-of-life process. Melissa tells us it's important to recognize the signs of when you should start thinking about seeking hospice care for your loved one.
Usually, the primary care provider will notify the patient or the family members that the patients have a prognosis of 6 months or less. So that's usually when we step in and we try to help them, provide as much comfort as we can at the end of life.
Melissa tells us if you find yourself at the emergency room frequently, it also might be a time to consider hospice as they have all the necessary equipment in the comfort of a patient's home.
So, and especially right now with COVID and everything, a lot of people don't want to expose themselves to doctor's offices or hospitals. So we're able to step in at that time and help them out at home.
The staff at Selah Hospice understands that taking care of your loved one in this stage on your own can be extremely difficult. That's why they're here to help.
Another sign that the patient is ready for hospice is when they're having more increased pain or shortness of breath that is hard to manage, especially at home, in the home setting. It's a lot harder to know what to do, what to give, what not to give, and when it's the time to seek more help.
Melissa tells us they offer full support to the entire family and are on duty 24/7 to achieve these results.
So when your body's getting ready to transition into end of life, you will notice that you're sleeping more hours a day and there is a decrease in appetite. The poor appetite could be due to many different factors. Sometimes it is the terminal conditions, sometimes it's due to nausea, sometimes you're just in pain, you don't want to eat. And sometimes patients just sleep through the mealtime so they won't eat.
So for whatever the case may be, Selah Hospice provides tailored care to each patient.
You could also notice that there is a change in mental status and extreme fatigue. And this can sometimes be due to poor oxygenation, poor nutrition, and fatigue. And we're here to help with that as well. We can provide help for activities of daily living, such as bathing, feeding, changing, things like that. And that's what we're here for.
So trust Selah to help you take care of your loved one. For more information, call 956-803-0895 or visit selahcare.com.